this is Amy and you're from the shop team in Cardiff.
Yep.
You can answer a few questions for us today that some young people have asked around sexual health and relationships. Would you like to give me a bit of background of where you're from, what you do?
Yeah, sure. So the Sexual Health Outreach Team, or we're also called the Healthy Relationship Service, work with young people across Cardiff, aged 11 to 25, on anything to do with sexual health and relationships, really. So we offer information, support, guidance, either in a group setting, so we go out to youth clubs, schools, hostels, anywhere where there's young people, and do group sessions. But mostly we do one-to-one work with young people, and it's confidential, it's free, and it's really for as long as the young person needs it. So there's no sort of time frame on it.
So some young people, I've been wondering, can they like kiss and hug or have sex now the lockdown rules have been eased?
Okay, so eased, I suppose, is the important word there. So the basic answer is no, they shouldn't be, because people, Welsh Government is saying that people still need to socially distance. So when, if you're outside, you still need to be keeping a 2 meters distance. So that makes it very hard to kiss and hug people if you're 2 meters apart. And I know that some households can bubble with another household. So if obviously that person is in that household, then you would be able to. Or of course, if you lived with that person, you would be able to kiss and hug. But other than that, then the answer really is no, not yet, unfortunately.
Okay. For those that are having sex, are they still able to get a C card at all?
Yeah, so our C card service is still running, but it's running slightly differently. So whereas people would usually have gone to like their youth club or school or somewhere to pick up their C card, we're now offering it via postal or delivery service. So we've got a number where people can call, or they can contact us via any sort of social media. If they're already signed up, we just take some details and we can arrange for the condoms to be posted, or we can deliver them. If somebody isn't signed up but needs to get signed up, we can do that, over video call as well. So yeah, it's still up and running.
Well, where can young people go for the morning after pill or a pregnancy test?
Okay, so the morning after pill or emergency or hormonal contraception can be got from most local pharmacies. Will provide that for free, so Boots included. So sometimes they say it's best to call ahead to check that the right person is there to be able to issue the morning after pill. But yeah, so especially with COVID as well, it's probably a good idea to ring and say, like, I need this, can I come down? And obviously, if you need support, to make that call, speak to like a youth worker, or you can contact us at SHOT and we can help you with that as well. And I would like to say as well that people do have up to 3 days after unprotected sex to use the emergency contraception. So it's not just for the morning after. And there is another type of pill as well that can be used up to 5 days. So don't panic if it is the morning after is gone. You can still go, and access it up to 72 hours after.
What about pregnancy tests?
Pregnancy tests. So if you're concerned that you might be pregnant, would be worth contacting the Department of Sexual Health. And so you ring the main number, and a doctor or sexual health nurse will call you back. And you can explain them what your situation is, and they will advise you the best port of call. So they might say to come in, and they'll be able to do that for you. Or again, perhaps you could speak to a youth worker or somebody, and they can contact us at SHOT, and we will be able to support you with that as well.
Do you know, like in Home Bargains and Poundland and stuff, they do pregnancy tests. Are they just as good as?
Yeah, and they're usually the sort of like the dip tests or the flow tests, and they can be just as good. I would usually advise people to buy more than one, just in case it doesn't work. But yeah, just as reliable, but don't just get the one, because sometimes one doesn't work, you need to do another one.
Okay, cool, thank you. What are the different forms of contraception that young people can get?
Oh, there's lots of different types of contraception. So obviously it's the condom, and we always advise the condom because it protects against pregnancy and STIs, and they're 98% effective when used correctly. So obviously condoms are one form. We've got things like the implant. So this is a hormonal contraception, if you see that. So that is what goes in somebody's arm by there. This is really sort of common amongst for young people to use because it can go in and stay in for 3 years, and that's over 99% effective. So that's a really good method. There's the injection, which doesn't look very, yeah, it looks a bit, but you have that every 3 months. There's the pill, and there's lots of different types of the pill. You get a patch, there's a vaginal ring. There's lots and lots of different types. So what we tend to say is you might try something. If you don't get on with it, you can always try something else. So there's lots of different things you can try. So
with that implant, when it goes in the arm, do they numb the arm or?
Yeah, so they will numb the arm slightly, and it's a little bit like, like a piercing gun, if you've ever had like your nose or your ears pierced, and they just pop it in. It takes seconds. It's really, really quick. Yeah. So
and then 3 years, they don't have to worry about it.
Yeah, so 3 years, no worries about getting pregnant, but obviously it doesn't protect, these don't protect against the STIs. So we would still advise people to use condoms, unless you and your partner have both been and got tested for STIs, but yeah, definitely condoms as well.
One young person has asked, how can I make it feel more natural with a condom on?
Okay, so lots of people sort of seem to have like issues with using condoms because it might feel differently. But there are loads of different types of condoms. So we've got, ultra thin condoms, so they are really, really thin. We've got textured condoms, like lots and lots of different types, and we've got a good range within C-Card as well. So it's worth maybe trying different types and seeing what suits you best. But I just think perhaps a condom is better than maybe ending up with an STI, and that's probably not going to feel very comfortable either. So a condom is worth it in that sense.
Yeah, definitely. Talking of STIs, are they able to get a sexual health test if they need it?
Yeah, we've got a really good scheme running at the moment in Wales. Frisky Wales are offering postal STI testing kits. And so you go onto the Frisky Wales website, it'll ask you like a bunch of questions to find out what sort of tests you need. So you can have tests for swab tests for chlamydia and gonorrhea, which is swabs for females, urine sample for males, and also blood testing as well for HIV, syphilis and hepatitis B. And you can get all or one of whatever test you need. They'll post it out to you with instructions of how to use it, and there's videos on the Frisky Wales website of like what you need to do to get the tests, and you send that back free of charge, and then they will be in contact to say whether it's a negative result or if it's a positive result that you have got an STI. They will put you in touch with your nearest clinic, so that's really, really good.
Really good.
Yeah. So that's excellent. And actually, if you ring the Department of Sexual Health, they will say that to you on the automated message as well. So there is this option to get from Frisky Wales. Obviously, if people have got symptoms or they're worried about something that they can see or feel down there, then definitely ring the Department of Sexual Health. And although they're operating differently, there's no walk-in services, it's appointment only. A doctor or nurse will call you and speak to you and advise you then whether you need to go in and see them or not.
Oh, that's really good.
So there's options.
So another question from a young person. If a boy says he'll pull out before coming, will that reduce the risk of getting pregnant?
So the withdrawal method or pull-out method is not something that we would ever recommend as an effective method to prevent pregnancy. Obviously, before a man ejaculates or comes, like, liquid is released from the penis without them even knowing. So this liquid can contain sperm, obviously, which means you would be at risk of, of pregnancy. So we don't recommend the pull-out method as an effective method. And also, again, you're still at risk of STIs because no condom is being used.
Do you know what the most prominent sexual transmitted infection is?
For young people, the most common is chlamydia, often because it has no symptoms, so people don't know that they've got it. So over half of people don't know that they've got chlamydia. The only way to find out is to get tested. So yeah, that's really common amongst young people in particular. So I think young people, across the country are responsible for like over half of all the diagnoses of STIs. So that's quite high, really.
Yeah.
So yeah, this is why we want people to keep safe and use condoms.
Yeah, definitely. So what happens if you have got chlamydia? What are the not symptoms, but what can you do?
Well, sometimes people do have symptoms, which could be sort of pain in the lower abdomen. It could be pain when you wee. It could be pain during sex, bleeding between periods for females. But the majority of people won't have any of these symptoms. If it's left untreated for a very long time, it can cause like problems with fertility, so your ability to have babies in the future. But the good thing about chlamydia is it's really easy to treat. So just a course of antibiotics and it will be gone. So that's really, really important. It's very, very simple to treat with antibiotics. So it's worth getting tested to find out.
Yeah, that's good.
Yeah.
So what services are open for me to get help across?
Okay, so I mean, like medical services, like the Department of Sexual Health is still running. So a lot of these services will be running a little bit differently, but they're still offering a service. So if you have any concerns medically like that, like with symptoms or pregnancy testing or unwanted pregnancies, you can contact the Department of Sexual Health and they will advise you the best sort of action to take. We got us, the sexual health outreach team. We're still sort of up and running, still taking on referrals and working with young people one-to-one. We've also been doing sort of young people's online webinars for all things sort of sexual health. And we're doing some stuff for parents and carers as well. But if you wanted support from us, like on a one-to-one, anyone can refer. So, a young person can check out like our social medias on Insta or Twitter or Facebook and find out more. But also there's Mike, and they offer a really good sort of overall general sort of advice and information service for young people, and they're really, really good. And online as well, like in terms of sexual health, websites such as brook.org are really, really good, and they've got really good information for young people in a really like young people friendly way. And also Think is a really good website and for like online stuff for keeping safe online. That's a really good young person friendly website as well.
Fab. And youth workers.
And all the youth workers, yeah. So I think youth workers are available to, for support, and I think going to be out and about street-based again.
Yeah, hopefully we'll be out and about street-based soon. All of us are trained in CCAD and healthy relationships, so they can come and chat to us as well.
Yeah, absolutely. Yeah, just speak to somebody, any concerns, speak to a trusted person. I think that's really important.
Fab. Oh, thank you very much. I think that's a lot of great information.
Fab.
Anything else you would like to add?
No, I think just make sure people stay safe and just enjoy the easing of lockdown, but just stay safe is important, I think.
Fab. Okay, thank you.